Thank you all very much. We are now back from recess, and though we might have another recess depending on how long this part of the meeting goes. But right now we're sitting as the Board of Health. We're going to receive an update on the COVID-19 and county public health planning from Dr. Gales and Dr. Stoddard and others. Dr. Gales, welcome and thank you for being with us. And if you could please lead us off. I see your name. I don't see you. So, no, I do see you. There you are. And there again, we sincerely appreciate your time and everyone being here. And if you have I know we're not the only thing that you do during the day. So if you have to leave or just let us know your time frame. We are most appreciative that you're giving time to us as well.
No problem. Thank you. And as always, a pleasure to be with you all. There is the launch of the domestic violence and COVID response at noon. And so we'll maybe slip off a little bit to get to that. So in the interest of time, I can answer questions, probably take more time to answer questions, but just to give you some 30,000 foot updates, our case count is at 15,737 for the state. We're at 3,060 cases in Montgomery County and 121 deaths. This is also in the setting of increased testing capacity as we've rolled out alternative test sites. We continue to test at our Beep station, and we launched a test site at Wheaton Rec Center and Library yesterday. That will be Wednesdays, and we will be launching one at the Germantown Upcounty Service Center. There we go. On Monday, and that will be a site for that. The hotline that we are working on building, we're hoping to go live next week. And again, the purpose of that will be for individuals, particularly for individuals who don't have access to a primary care provider, to be able to talk to a provider and get triaged and screened over the phone and have a test order for them at any of those sites that we now have available. We continue to work with behind the scenes to create a mechanism to be able to rapidly respond to needs within the community from large part a social determinants of health driven team. We mentioned earlier that the state has created a vulnerable populations team and the rapid response teams that they are providing. There's 2 being provided to 4 jurisdictions across the state with the most cases. That model includes an EMT and a social worker case manager type person. And so we're getting 2 of those teams, and we've linked one of the teams. They haven't started yet. They're doing the logistics. We're going to link one of those teams with our Services to End and Prevent Homelessness program to start with, and then the other one we are working to link them with Impact Silver Springs, recognizing that they do a lot of work in some of those higher volume zip codes. Now, in spite of just those 2 teams, we are working behind the scenes as well to create a larger county version of that. And we're working to figure out how to narrow that down. That would include a number of resources. One, a rapid response component, as well as we're toying with the idea of creating COVID recovery specialists. And so COVID recovery specialists would be individuals who follow up with those who have tested positive to check in with them to see if they're doing well clinically, what are their needs, how are their families doing, to begin to be able to address some of those other issues that pop up within the setting of COVID-19. We did respond back to our hospital partners, and they will be receiving the funding from the county's allocation related to surge planning. That was communicated on yesterday. And we continue to train individuals to provide an additional level of services. We continue with our nursing home go teams that have been very active in terms of working with facilities across the county. We've had our state partners come in and do a number of site visits as well, individually, as well as their go team has come to, I think, 2 facilities within the county. And we have trained a cadre of folks to be able to perform the same services for our D&D group homes, and they will go live on next week as well. And we are continuing contact tracing. We trained 21 of our school health nurses on yesterday to be able to provide additional support in that endeavor. And we continue to work with our academic partners. I have a meeting with the University of Maryland this afternoon to triage and check in to see, how are we doing in the acute response. But as we continue to respond acutely in the short term, we have already started to think about what is our long-term future look like post-COVID, and to begin those discussions and thinking about what types of steps we need to take to create that long-term sustainability, but also think about it as the context as we're responding right now in the acute setting. What are measures that we can put in place now that will address our short-term issues, but also have a profound impact on our long-term future? I'll stop there. There's always plenty to talk about, but happy to leave space for questions.
Thank you very much. Councilmember Giwando.
Thank you, Council President, and thank you, Dr. Gales and Dr. Stoddard, for all the work you're doing, as always, in this unprecedented time. Following up on a couple things that you mentioned, Dr. Gales, on the Go Teams, really happy to hear that we've been able to launch an additional one in Wheaton, additional site in Wheaton and coming up in Germantown. Talk to me about the staffing and where that stands. I know that had been an issue with some of this and the ability to get them up as in going and related to staffing, and if that's still a challenge. And then also as you head into the hotline, which we've been talking about, I appreciate working with you on the issue of the disparities and how access to care, and this could really be a big help in that regard. Do we have enough providers to staff that hotline, and do you need some help there? And I just, wanted to know how that's going. Are there any impediments, any way that we or others that might be listening, the millions watching at home, that I'd like to say could help in those areas, and just get an update on those two questions.
So the second part, for the billions of people watching at home, if you are a provider and interested in providing those services, let us know. We can always use volunteers for that, and we do have a mechanism. So definitely, if you have that clinical background and are able to utilize a CRISP platform to order and prescribe a test, let us know and have an interest in participating. So that is the staffing piece is what we've reached out to our minority health initiatives and program to recruit volunteers for those mechanisms, ensuring that we have a diverse cadre of providers there to be able to meet some of the needs of the community and folks calling in. But if there are others interested, we definitely would take your information and have a conversation. So the first part, I think if I understand it correctly, you were referring to the testing sites at Wheaton?
Yes. Yeah.
Okay.
How's the staffing? And I know that was an issue. And then you can add on to that the testing capacity. I mean, we obviously heard the news from Governor Hogan and how that's filtering down. And is that going to, when and how soon will that expand our ability? I get jealous when I see Detroit, they're doing 1,000 tests a day. I know that was a goal of ours, I think around that number or something. So could you just tell us where we are on testing capacity and how that is going?
Sure. So the first component, so the staffing actually has been, we've been able to train multiple teams now in order to participate in those processes. So we have utilized our dental staff, who, as we know, our dental program is closed except for emergencies. And so their team, the providers, have been participating in terms of specimen collection. We've got volunteers from our school health nurse cadre and volunteers through other areas. So staffing has been less the issue as we've trained multiple groups now. It's been more of the testing capacity. So that was the rate limiting step in terms of scaling up to be able to perform at one site, and let alone multiple sites. We've been able to grow and leverage our partnership through LabCorp and Quest in terms of their provisions. We have also been pursuing a number of other opportunities with other lab companies to be able to expand the scope and create multiple options for us to utilize to ensure that we have the adequate capacity to be able to perform the tests that we need. And so I would say be very careful when comparing to other jurisdictions, so you won't. So hopefully this will take away some of the jealousy on this. Is that one of the reasons that we do have a very extensive health system network, even though we do recognize a lot of people are still locked out of that. We do have a fairly extensive network with 6 hospitals and a significant network of primary care providers who are affiliated with those institutions. And so with a lot of those places offering tests, a lot of people are covered within that space. And so what we're excited about, though, is that, and this is different from a lot of jurisdictions who unfortunately haven't had the capacity to be able to launch health department-driven testing that is free and for most and available. And so that's why we're excited to be able to grow these sites for folks who we know don't have an opportunity to interface in those other places. Now, just briefly to the point about the test kits from the governor. I think the best answer I can say is I think there are details being worked out at that level that have not filtered down to the health departments in terms of explaining how they will be used, how they will be allocated and distributed to the respective jurisdictions. But once we find that out, we'll be sure to share it with you all.
Okay. And on those 2 sites that you mentioned, is that going to be similar, 50, 100 tests a day? What's the goal at the pop-up sites, or what's the capacity rather?
Well, right now the capacity is during the soft launches. The goal is somewhere between 50 and 100. But certainly, as we're expanding capacity at the Veep site on Tuesdays and Thursdays, we are increasing our capacity and probably going to be closer to the 500 range as things move forward. But certainly, our goal would be to be able to provide 1,000 tests a week.
I appreciate that. And as you know, being able to know where things are and how we're doing, and testing is a big part of that. So I really appreciate the work you all are doing. Thank you, Mr. President.
Thank you. Councilmember Reamer.
Thank you so much. Yes, wanted to also talk about testing and tracing as well. Testing and tracing, once you have hospital system capacity and are the essential components of a strategy to get the virus under control. And as we know, the governor has announced a 4-point roadmap to reopening, and testing and tracing are essential elements of that strategy. So I think the governor's been terrific about being really aggressive in securing additional testing capacity. Really excited about the announcement with the South Korean companies that they're purchasing tests from, as well as the announcement about the new tracing initiative that is partnered with the Bethesda-based company, National Opinion Resource Center. We, on tracing, so the governor announced yesterday that the state capacity with this partnership with NORC would be for 1,000 cases, I think, a day. Is that right, Dr. Gales?
That sounds about right.
I think that's what I believe that's what he said. But so yesterday there was almost 1,000 new cases in Maryland. Hopefully that will, or today, I'm sorry, today. Yesterday was 567 or something. Today it's almost 1,000. I'm just concerned that I'm pleased to hear that you have identified another 25 people to add to the tracing strategy here. I think there's really nothing more effective that we can do to get control of the situation, get the economy reopened, than boosting what we do with tracing and testing. So to monitor the progress of that, I think, is the key element for us as an oversight body. So I had earlier requested on a different call if we could have a report from the county. I don't know if Dr. Gales, if you would provide that, or if HHS would provide it generally, but it would show all the cases. Obviously there's HIPAA issues, so it wouldn't have names, but it would just show how many cases have been traced and then what the outcome of the tracing is. And then if we could have that kind of updated regularly. Are you planning to produce something like that, Dr. Gales?
Well, I think in order to inform that question, I think that there has to be a little bit of level setting in terms of the purpose of contact tracing. So as you're right, contact tracing is to map things out and put into one, to identify individuals who may have come into contact with that index case, and ensure they have been given the proper guidance in terms of quarantining, and if they need to get tested, giving them direction within that. So let me be clear, we've been contact tracing since the beginning of this. And so we're not starting from ground zero. Before the focus was put on to contact tracing earlier last week, we had interviewed, I want to say, nearly 1,000 of our cases. At that point, I think we were at around 1,600 cases. So we had interviewed approximately 55 to 60% of our cases and conducted that. And in large part, they were, and when I say that, it's not that folks weren't called, it's just that we had a priority system in terms of who was getting called right away. So any of our nursing home cases or hospital cases, anyone over the age of 60 in terms of being identified as a vulnerable group, any one of our county employees, any pediatric cases, and anyone, who was connected to a potential large-scale exposure based upon their employee status, or something that popped up in that history was concerning. So we were already contact tracing the majority of our cases. Before the emphasis was put largely, we had actually scaled back because we had caught up on the age front and scaled back down to interview, making sure everyone over the age of 50 received, not that everybody isn't getting an interview, but a call within that first 24 hours of getting that information. So the additional resources allows for us to be able to include more within that time frame, because as you can imagine, as you talked about, there being 1,000 new cases a day, in our jurisdiction, I think the most cases we had one day was about 225, 230. So you can imagine that that's a high volume. And so we try to work quickly to make sure folks are contacted within at least a 48-hour window. Now, as it relates to how that information is disseminated, our EPI team has been going through our case report form. We ask a host of different questions, and I'm only going to give a visual because it's sitting right next to me. So here's the form. It's three pages of questions that are asked as part of that interview. Everything from where you live, your background, insurance status, who you've come into contact with, what types of pre-existing conditions you have, what have been the symptoms that are associated with it. So the team is working to clean the data to be able to present and say, at this time, we can say that we can present on 65% of the cases that we've had, and here's the profile of COVID-19 in the county. And so that's the first level of reporting, so to speak, that we're putting out. I think it would be very tricky beyond that because the cases are being actively investigated. But I think that another layer of that could be if there's any potential cluster that's identified. Certainly, we would not only report that to you all, but we would try to report that as best as we can to the public. If we saw something that jumped out, or we saw, hey, we found, and I'll say this as a tennis player, if we said, everybody, we've really found that 90% of our cases are tied to people playing tennis. So we would say stop playing tennis, period, to remove that particular exposure. Does that answer your question?
So a few key points. I understand that our effort has been swamped by the volume of cases, and I'm not surprised. The spike has been far greater. So, the fact that we were able to trace 50 to 60% of the cases, I understand that is just the reality of a triage situation. How long before we'll be at 100%? And in the tracing, is it a contact with the patient to just develop a profile of them, or is it then are we also with the 60% that we've done following up to find out, going through that chain of contacts? And so actually it's not one person we're contacting, it's 5 or 10 or 15.
Yes, so that's the fundamentals of how the contact tracing is done, in particular as we get more information. Because also one of the limiting factors is, remember that we haven't always had full access to the lab reports. That didn't start from the beginning. So now we have full access to that, so we can pull that data in real time to be able to say, okay, I'm interviewing Hans and I've got his case here, and it pops up. He tells me, I was at the county council building and he was hanging out with these 3 people. Oh, I also look in my database and I see, well, 2 of those people are cases. So you can start linking cases that way to be able to identify as best as you can when a person may have come into contact, who may be the index case, and how they may, what has been the network of transmission from that one particular person. So in a perfect world, that's how the contact tracing happens, and you can have these elaborate maps that show, from, case 1 to case 2, 3, 4, and 5, and start to understand what were the particular factors that drove the mechanisms of transmission in each case.
I thought a key objective, though, was to contact people and tell them to quarantine.
Yes, that is a key component, and that was part of explaining that process. Is if, for example, if you think back to the very beginning, when we had one of our first 3 cases, we identified that they were at a particular venue, and we put out information to say, "Hi, if you were at this venue, you need to have we need to have a conversation to talk about your level of exposure." And so certainly, if there are large-scale situations like that, or as you referenced, if you have said, I came into contact with these 5 people, their names are A, B, C, D, and F, D, and E. We would contact those folks and say, hey, you may have had a potential exposure. You should consider quarantining to prevent you from coming into contact with other folks. So there's multiple components to how it's done.
Okay, thank you. Just to close out this topic, again, this is helpful. I would really like to see us at 100% of cases traced with their contacts, the 10 or 15 people or the 5 people, traced and then tested. I think if someone is known to have had it, then everyone that they've been in contact with should be tested, because they could be pre-symptomatic or asymptomatic. And so I imagine that would require an expansion of testing capacity if it's pre-symptomatic. But on testing, appreciated Councilmember Giwando's questions, because I think this is such an important topic. I think we could purchase more tests. There are tests out there that we can purchase. My understanding from some of the health providers, like the community clinics, is that at this time they still have to show symptoms. The employees have to show symptoms in order to get tests. And it's my understanding the CDC guidance for communities is that healthcare workers should be able to get tests without showing symptoms. Can you talk about that issue, please?
As it relates to a specific venue?
Or just, like, for example, workers in Montgomery Cares clinics, if they have had I believe that the CDC guidance is that healthcare workers should, and first responders should be able to have tests regardless of symptoms if they just feel that there's a need for a test. But my understanding is we're not there yet.
Well, I would caution, from making blanket statements because every situation is different. And in fact, we have worked very carefully with, for example, county employees who may have had a potential exposure. We've worked with OMS to make provisions for, we certainly recommend that folks go through their healthcare provider who have access to a healthcare provider to go that route, but have made provisions to help increase access to testing for individuals, particularly first-line responders who may have come into contact with something or had a concerning exposure. And so I think that, every situation is different. So I would be careful in terms of making a broad generalization. But in instances, for example, where we have had staff in nursing homes, we have encouraged folks to get their staff tested through those mechanisms or help them figure out how to use and leverage the partnerships they have with the labs who provide them services to be able to get their employees and staff screened and the tests that they need. We are not at a point where we're doing testing on demand, because not only is it a question of capacity, but it's also testing, understanding the mechanisms behind disease processes. So individuals, there's a timing to a test. So for example, if I come into contact with you right now, me going out to get a test right away is going to present a potential false negative, as it is going to take some time for symptoms to develop. So it's a question of capacity. It's a question of timing. It's also a question of what the type and quality of exposure an individual has with some person to determine their level of risk and what necessitates appropriate follow-up.
Okay, thank you. I'll close up by just saying I believe that we should add funding for additional testing capacity. I think it would be helpful to expand to certain populations that we have not yet been able to provide a looser guideline for testing ability. So thank you for your work.
Thank you. Councilmember Navarro.
Thank you, Mr. President, and thank you, Dr. Gales and Dr. Stoddard. So I wanted to just kind of, first of all, express my appreciation, of course, for how the governor has been handling this particular pandemic. I think we've seen different ways and different approaches. I remain concerned that, of course, we're number 2 in the state in terms of numbers of cases. And then, of course, the zip codes that are in my district and share some with Councilmember Hucker continue to be leading. And so that brings me to this, overall strategy question regarding what more could we be doing? I agree with some of the comments that have been made. I think that, we are all working around the clock to try to mitigate what we can. We know it's not a perfect system. It's a very troubling and unprecedented, uncharted territory. But I think that we, at least hearing from you, Dr. Gales, there seems to be some parameters that we should all be, looking at following. And I feel like we should be doing something to expand that some. So I personally, you don't have to answer this right now, but I would love to understand via a summary or something to that effect what it is that we're particularly doing in those zip codes that happen to be in my district specifically. I appreciate, the mention of partnering with Impact Silver Spring, et cetera, and opening the testing site at Wheaton, et cetera. But I think that obviously we know that we could do more. I think that this council has shown our desire to work proactively with the administration to, quickly and nimbly provide whatever resources or capacity can be out there. I just don't want us to just sort of follow what seems to be the status quo roadmap, because as we have seen, every jurisdiction is different. Every jurisdiction has particular characteristics. And so I'm interested in how we can, kind of expand our scope a little bit, given that we now are seeing some patterns. I will also add that I look forward to us understanding how we're going to receive the additional capacity for tests that the governor has procured. I did forward to Mr. Shetty yesterday, and I just realized I forwarded to the both of you a contact that I received, somebody that I do know who's working with other jurisdictions in the region to secure some additional test capacity from the same South Korea connection. And I think that, again, if we explore particular avenues of that sort, perhaps we can provide that additional capacity. But again, I remain concerned that not only are we number 2 in the state, but that we do have these consistent numbers in particular zip codes where we've known, because we have already documented through research and data that we have, that these are the zip codes where you have a preponderance of, Black population as well as Latino population, most disproportionately affected by especially access to healthcare. So, just food for thought, given that we are all doing whatever we can, but I think now that we have a fuller picture, I would like to see us trying to pursue some additional capacities to address this, because it is pretty dire. And even, what we're trying to do to communicate and address communities who are under a lot of distress, it's still challenging. There's still many folks out there who don't understand quite clearly what to do when they think they may need to be tested, think they may be exposed. That's a real big challenge, and I worry about that in terms of how now we're starting to talk about reopening. Council of Governments yesterday, we adopted this resolution to work together as a region, but the reality is, as I said, every jurisdiction is dealing with this in a different way. So I just request, perhaps a summary of what we're doing specifically in those zip codes, 20902, 904, 906, and then also, what could we do to expand our capacity a little bit more would be great.
Okay. You're going to be looking into that, Dr. Gales?
Yes, and I mean, we're actually already doing a fair amount of work, and I think it's important to also look at, there are lots of organizations doing this work in the community already and looking at how we can leverage those resources. Because I do think a large part of what you're talking about aren't necessarily tied to public health related things. And I think that there has to be a larger, broader network, as you mentioned, in terms of addressing strategies. For example, when we talk about the factors that are driving disparities in COVID-19, as you mentioned in those zip codes, a lot of these things are longstanding issues. And so in order to address them, it's going to take short-term solutions to figure out how to implement strategies and continue the work that we're doing to meet immediate needs. But there has to be a larger conversation about how these systemic factors are in place and how do we change them. And so we are thinking outside the box. I think an example of that, for example, this afternoon, I'm talking with Dean Lushniak at University of Maryland to say, hey, are we missing anything? You know, these are our public health colleagues. Are we missing anything? What types of steps do we need to put into place to address specific concerns in neighborhoods? But the work that we're talking about doing is not something that, you know, public health can do alone. It's going to take the full complement of all of the organizations and resources we have in our community to address housing, food security, transportation access to care. You know, one of the things that I think that is lost in this is, you know, we need to continue to emphasize people getting enrolled into care. You know, for example, individuals eligible for Medicaid, individuals eligible for ACA, because that we know, unfortunately, for a lot of people who are locked out of the system, you know, insurance status matters in terms of getting access to a primary care provider. And so we need to continue to do what we can in our community to ensure individuals who are eligible for those types of services are linked to those services and getting the services that they need. So I think it's a full complement, as you mentioned. And, you know, we're continuing to think through and look at all those strategies, but it's going to take a collective effort of all of us, all across all the government agencies and community agencies to be able to provide the response that we need.
I appreciate that. I think that it's clear that right now the pandemic, it's sort of like the epicenter, right, of what it is that we need to keep in mind. But there is no doubt, and I think this county and this council have done quite a bit already, including landmark, you know, racial equity and social justice legislation, which, by the way, was already introduced in the New York State General Assembly, exactly modeling our bill. So I think we're leading in many of those instances, and there is no doubt that there's more work to do. But I'm really concerned and interested in what we have right now in front of us, which is this pandemic. And so the good news, I think, is that because we've done so much already, we have a lot of capacity, as you were just saying, right? We have a lot of community organizations, we have a lot of resources that we have invested, et cetera. And so from my standpoint, what I want to know is how strategically are we in terms of those geographic areas where we know there are still many folks who, you know, have to make some difficult choices. We saw what happened at Megamart, right? And that was not just about, you know, food insecurity, right? That was just about a lot of things, such as culturally appropriate access to food at this time, right? Or folks that maybe, you know, felt that they would risk their lives even because they needed to put this food on the table. We're a county that has all of those layers. And so I would like to continue to have this conversation. You play a pivotal role because you are the health officer. And right now, as I said, you know, the pandemic is in the center of everything. But I think we would like to understand where we are, which I think is in a pretty good place. But where else can we go, you know, in partnership with my colleagues, the executive, you know, Dr. Stoddard, everybody, so that we can kind of boost our response to that next level. Thank you.
Thank you. Councilmember Rice.
Well, thank you very much. I'm going to try and do this quickly. So, Dr. Gales, when it comes to contact tracing, and you talked about ramping up staffing, one of the things that I've been doing a lot of reading in my spare time has been digital versus traditional. And so I'm very curious as to, because you've talked about the challenges with staffing, and obviously digital certainly works better, but having people sign up for, I haven't seen anyone nationally talk about signing up for and getting people to come into this sort of idea of digital tracing, which would help tremendously the efforts of health departments throughout the nation. So I'm curious as to what your thoughts are and if there's going to be any movement in that direction.
So yes, digital tracing is an innovative strategy. It's one that, so I think for the folks, for you all and the folks at home, is contact tracing has been a part of public health for decades. And it's something that we do with tuberculosis. We do it for sexually transmitted diseases, particularly HIV and syphilis, in some cases gonorrhea. And so recognizing that, and unfortunately, those who do contact tracing, those budgets have been cut over the last 5 years. And we've had to, unfortunately, many health departments have had to lay off disease intervention specialists, who are the primary folks who do contact tracing. We have a robust staff here, though, that are experts in that area and will participate in the process. And so to that end, recognizing those staffing shortages, there have been a number of strategies utilized to increase access. So, for example, if an individual coming in, having a presence on message boards and social media, being able to track down and get information for folks to notify them that way, all in a confidential and private manner, obviously. And so those are, again, part of our toolkit that we already have in place and certainly can be scaled up and will need to be scaled up, quite frankly, due to the volume that we have. And making it easier to find and track down folks in a quicker manner, again, because the window is important. If I can get to you before you have come into contact with layers of other folks, then we can cut down on the potential transmission.
So my other question relates to that, because I've noticed that even with the number of cases that we have, I haven't seen any public alerts. And what I mean by this is, if you were in Lowe's between 8 a.m. and 12 p.m. on XYZ day, you need to contact the health department, because I know Lowe's doesn't have records of every person who went in there. Person went in there to buy a screwdriver, they paid with cash, they were exposed to somebody who was also at the Lowe's. I haven't, and again, if they're not following what's going on, how we're outreaching to them. So when we talk about ramping up contact tracing, I really think the only way for us to really truly get around getting notice out to people is going to be through digital means. Can you just talk a little bit about what some of the strategies have been to this point to outreach to folks who are in community settings, like a grocery store, like a retail store that's still open, like a restaurant, who, folks are picking up and they're standing outside waiting, those kinds of things, how we've been able to outreach people to do that contract tracing to this point?
So when we have had cases involving larger outlets like that, we have made that, we have announced that. And so
how did you do that, though? Because I haven't seen any of those notifications. I don't know if maybe my members have, but I haven't seen any of those.
Well, part of it is you haven't seen it because we haven't put any out. So I mean, so the absence of not seeing them isn't because we're not putting them out. It's just those are used in cases where, again, we have information to suggest that they're based upon the level of exposure. There was a person at this site at that time, and I hate going back to that one of the first ones, but the nursing home in Rockville, the Villages of Rockville, where we said we know a person tested positive who was in this space at this time if you were there. And there have been some smaller cases where we've had to, there are controlled situations where we know there were a number of other people who have been notified. And I want folks to understand, in the absence of, a larger press release, those folks have been notified. So, whether we're talking about a staff member at a particular job, when we found out the case, we've communicated with employer to say, hey, you had a person test positive. We need to do a deeper investigation. Here are the folks who need to be quarantined. Here are the folks who need to be self-monitored. So that work has been going on. It's just not in the public eye because we've not needed to do so on a large scale. So if we do get that again, we do get to the point where there is a large scale exposure, we certainly would proactively put that information out into the public. And, that would include, through our social media platforms, the old-fashioned standard press release. I hate to say old-fashioned because Mary Anderson over here, But the traditional press release mechanism to spread the word, to make sure that folks, if there is a high risk exposure involving a significant number of people, we would try to get that out to as many people as we could.
So last, just two quick ones. Priority testing in communities of color. I agree with what Councilmember Navarro and others have said. I just feel as though it's incredibly important for us. There's a lot of conversation about this nationally too, about that being a focus for us. So I hope that as we expand, and I know that you brought it to Germantown, which is great. That's got a large pocket of our African American community. I know in East County, same thing. So you're headed in that direction. But I think also, again, lowering some of the thresholds in which people need to present in terms of why they would get testing would certainly help us, and be able to enact a different kind of contact tracing as well that's more preventative than it is reactive. So I just hope that we'll get into that realm of doing things. And then lastly, one of the things, as folks are talking about this plan to reopen, a very interesting CDC study that came from partnership with Wuhan about air conditioning and air conditioning spread. And as we go into the summer months, and this would be the same timing at which we're also looking at possibly some sort of reopening, especially when it comes to some other shops. I mean, we already have the governor saying that a couple, barber shops that do very specific one-on-one can open up. And there wasn't a lot of press about that, which I thought was kind of interesting. But as an aside, I'm just trying to understand, have you guys given any thought to that and any kind of guidance that you may give to retail stores as well as to restaurants and other smaller establishments about what to do with regards to ventilation and air conditioning?
Yes, so we've actually provided a significant amount of guidance on that, in particular to our large congregate housing settings, apartment buildings, and things like that, from the very beginning. And so we can easily tailor that information to the respective populations that you mentioned.
Excellent. Thank you. Thank you, Mr. President.
Thank you. Thank you, Dr. Gales. Dr. Stoddard, please.
All right, I'm finally unmuted. All right. A few things I want to cover. First off, thank you, Council President Katz and members of the County Council for entertaining this update today. Thank you for your continued support. I've received at least 2 messages from council members during this briefing on PPE leads, and I think every one of you has sent a PPE lead at some point or another, and I appreciate that. We do track those down, as you have already mentioned. Ash Shetty, the procurement director, is leading our efforts to reach out to new PPE vendors and acquire those resources as we have available. While we've been in this briefing, we actually drove over to a local vendor and picked up 4,000 N95s that they had on the shelves and we could take off their hands, and we were more than happy to do so. And so we've utilized a number of creative solutions to try and address our PPE challenges. And I really appreciate the efforts of the Procurement Office and Department of General Services for really going above and beyond and trying to find every legal pathway that we can find to acquire PPE during incredibly challenging times. We've seen a number of FBI reports about not just arrests that have been made for people making fraudulent offers to governments, but also production of fraudulent equipment, including the 3M N95s. There was an FBI bulletin put out about that. And so it's an incredibly challenging time, not just from the supply chain challenges that we face, but also from the more nefarious providers out there who are trying to take advantage of the situation. In addition, so with that 4,000, we're over 10,000 N95s secured this week, which is a good week. We have a very large number of very large orders of PPE, including consecutive orders through COG actually for 350,000 N95 masks. Now, we've had 100,000 mask deliveries that have been delayed already. We had one that was supposed to come in yesterday, and not surprisingly, it didn't. And so we are continuing to put as many hooks in the water as we can, recognizing that there are very few fish in the sea. And so we're going to continue to do that. I would also point out that through our donations mechanism, we have seen a tremendous outpouring from our community, both in terms of provision of medical grade PPE, but also production of cloth masks that we turn around and distribute to our nonprofits and other providers as well. When we receive, this is either for donations, shipments from the state, which we will receive another today, We are providing PPE directly to our nursing homes, long-term care facilities, in some cases hospitals, our DD providers, our homeless shelters, places where we know that there is either congregate living or other activities that put people at additional risk. Last Friday, based on what we were seeing in our correctional facilities, I did push and have N95s provided to all of our correctional staff in the correctional setting. We have already provided cloth masks. There were lower quality cloth masks, and we recognize that to the inmates. We're going to replace those with a shipment that we're expecting this Friday. And so that's more to come on that. The other big piece of news in the PPE realm is that a Battelle unit, which is one of those $1 million units that Battelle has been producing that decontaminates N95s, one of those units has been installed in the district that will be a shared resource in the National Capital Region. That system can clean 80,000 N95s per day, and we are entitled to, in Maryland, between us and Prince George's County, a third of that production. And so that will allow us to process, 25,000 plus, clean 25,000 plus N95s. And the really nice thing about it is they'll actually come out and pick up the masks, clean them, bring them back to us. And so it's a very low stress process for the county. And so that should start up. I want to say soon, because we haven't given final details on when they're going to be ready to receive and when they're going to do the first shipments. I think the apparatus was just installed yesterday, and so I think they're doing some test runs and things like that to make sure it's operating correctly, but then it should start soon. Again, with the decontaminated mask, we do not view decontaminated masks as the same as a fresh, new, unused mask, and so in all cases we're preferring to use the unused N95, but obviously during austere times, a professionally decontaminated N95 is better than no N95, and so we will continue to plan accordingly. On cloth masks, we did do initial distribution to all county employees, DD providers, inmates, correctional personnel, MCPS food providers, of course, council staff, a cloth mask on the week of April 10th. We recognize that those cloth masks were pretty flimsy. And so we're in the process of acquiring additional supplies. We've acquired about 3,000 of the sturdier masks now. Those have all gone back out the door to ride-on bus drivers in the correctional environments, ABS, stores and warehouse staff, and I believe housing and permitting service inspectors who are out in the field, and others. We expect, again, the larger shipment to come in Friday or Saturday. It's actually we've got the tracking number. We're tracking it arriving. We have no reason to believe there will be any impact on its delivery, and so we should know late this week, over the weekend, that they're going to arrive. In addition, yesterday, we have been planning for several days, and yesterday I did have an opportunity to talk to Councilmember Glass about an effort to put cloth masks on our ride-on bus system. And I'm happy to report that I expect that effective Monday, we will be minimally doing a pilot of that program and more hopefully doing a broader effort to allow for cloth masks to be available on all of our ride-on buses. We've got what we think is a workable solution to have those masks be available, and we do have sufficient numbers of the masks, on hand to do. They will be essentially those low-quality masks that we initially sent out. We're actually having sewn together to make a double layer to make it a little sturdier, and we're going to use those as the initial rounds to just work through the solution. But obviously we have several large shipments of cloth masks coming in that we'll use to continue and expand that program moving forward. We're also looking at using the MCPS feeding sites and other nonprofit partners to distribute cloth masks publicly. And so we will be expanding from that ride-on effort. I would expect every week moving forward, we will have new opportunities and more opportunities to provide cloth masks and cloth mask replacements to the community at large, our employees, and those who support county government through their contractual relationship or as a nonprofit. I also want to talk a bit about the Food Security Task Force. This has been a big effort that we've undertaken. And I want to make clear that we're not in any way operating as a replacement for the Food Council and the efforts that they have incredibly done for a long period of time now, but rather to augment and supplement those efforts in light of the increased demand of COVID-19. Now I want to talk a little bit about that increased demand quickly. We've seen a 9% increase in total recipients and a 7% increase in households seeking SNAP assistance. The Manna Food Center put together a nice graphic and sent it out in the Food Security Task Force reports. I know many of your offices participate in that, so you should have received a copy of the report. And if you did not, I can certainly share it. Between March 5th and April 15th, they measured the number of households per 1,000 households who have been a first-time use of the Manna Food Center process in each zip code. And so I want to give some context for some numbers too. So the top top 6 zip codes, there was a tie at 5 and 6. 8.7 households per 1,000 in the 20877 Gaithersburg area. These are new households. That's per 1,000. So that's it's a fairly considerable number of people who have needed to access the Manna Food Center process for the first time in the last year during a 6-week period between March 5th and April 15th. 5.6 in the 20886, which is also Gaithersburg. 4.5 in the 20861, which I believe is Rockville Aspen Hill area. 20903, 20906, and 20879, which are obviously Silver Spring, and also Montgomery Village are the areas that we're seeing the most increase in food access requests. We're seeing it across the board. The food providers have seen an increase. Nourish Now is doing 5 times the number of meal distributions that they had previously done before March. 301 has seen an uptick in the call volume by about 40% in food referral requests over that same period. Food pounds being distributed and meals distributed are up. And so we know that there's an increased need across the board. So how are we addressing the need? Well, there's a couple things we're doing. First off, we want to make sure that the providers have appropriate protection. So we are in many cases providing PPE, hand sanitizer, and other supplies to the existing food provider network. Number 2, we are increasing the availability of resources to them, both in terms of money, but also over the short and medium term in other resources, whether they be delivery support, personnel support, other things that they may need. Initially, we've identified $500,000 within the individual assistance supplemental that the HHS received that we believe is going to be focused on food security issues. The Food Task Force, which is obviously comprised of the Food Council, Emergency Management, and Health and Human Services, as well as staffed by a contingent of county employees, but also nonprofit partners across the board, council staff, and others. MCPS is involved in that as well. And so they're the ones producing the ask. We want them to tell us what they need, and we will provide them what they need, both in the short term, and I would expect it will be executive branch ask in support of the Food Security Task Force soon. I'm trying to press them to get us some resource needs, but at the same time giving them the space to have a more holistic ask, which is not just going to be money or resources, but rather all the things that they need. And so, they're working diligently on that. We want to just give them the space to give us a more complete short-term ask. The initial $500,000 that is part of the HHS award will certainly cover them in the short term, just giving them enough resources. In addition, I know the governor has said he's going to put $4 million into the Maryland Food Bank and Capital Food Bank. We've got some more information about what that distribution looks like, and it should be coming soon. But there are some additional resources in the pot already to help them in the most immediate term. And I think very shortly, as in this week or potentially early next week, we should have a more holistic short-term outlay for what we're going to need to support them. The last 2 things I want to touch on, and very briefly, as in a couple sentences each, is we did receive the Treasury Department, U.S. Treasury Department did release guidance on the CARES Act late last night. There's some good news in there in that they are allowing us to consider second-order effects like the economic impact to our businesses as part of the use of the CARES grant. So things like the FED grant will largely be covered under the CARES Act money, which is good news. They do have a preclusion right now, which I know is subject to congressional negotiation moving forward, on the ability of local jurisdictions to use the funds themselves to augment economic loss to the county or state level. And so we cannot currently do that. We do know that that is a point of negotiation moving forward. I know there's additional money being discussed in future phases of the federal support. So we're hopeful that will change soon. But we are, Rich Madalino and I are going to work together with influence, obviously heavily from HHS, on a strategy moving forward for how we can utilize those funds, recognizing that those funds have to last us between now and December when they're allotted for. So we want to have a strategy that recognizes the situation we're in now and what we may face in future months. Finally, as far as community recovery goes, I've talked previously about the fact that we have stood up our emergency support function 14, which is community recovery. Right now, we're tackling the process questions, and we're going to get more into the substance questions next week. I do strongly. So we're going to make a proposal to the county executive on how exactly we think the process should go, potentially as early as tomorrow. And from that, I would anticipate that council will absolutely be engaged on the on various levels of the community recovery process. And when I mean engaged, not as in you receive a briefing on it and what's going on, but actually integrated into the process for how we make decisions and reflect priorities. And so I promise we will have more to come on that next week. You will hear from us exactly how we're going to integrate those things and make sure that you all are involved in recognizing the priorities that we have moving forward. Again, as Dr. Gale said, in Montgomery County, we certainly believe in following a database, science-based recovery process. And so while we're working on the actual nuts and bolts of how it'll work, everything in recovery will be dictated by the science. And so Dr. Gales and his team at Public Health will be driving a lot of almost all of the timing of how things will proceed based on how safe we believe it is to do certain things. But we just want to have a framework under which we can take what Dr. Gales and Public Health team tell us that we can do and have a mechanism to enact it. So with that, I'll stop and take questions.
Thank you very much. Councilmember Rice.
Thank you very much, Mr. President, and thank you, Dr. Stoddard. I really appreciate it, and I appreciate you mentioning about food expansion. I just wanted to highlight for my colleagues that MANA will be expanding from 9 sites with their weekend backpack program to 11, but there'll actually be a larger need. And one of the things I just wanted to flag for us and get your thoughts, Dr. Stoddard, on this is that over the summer, we normally have our summer program that provides meals, but the reality is the drawdown is going to be much, much larger. And so there is going to be a continued need for us to try and expand these sites, understanding that our capacity with public transportation will continue to be challenged. And so it'll make it harder for folks to continue to try and get to some of these areas. It's the reason why MCPS has expanded their sites. And now our partners like MANA, Women in Care Ministries, and others have expanded their sites as well. Are we looking from an emergency management perspective in terms of a strategy for the long haul, understanding that while some businesses may eventually start to reopen, the reality is that there's still going to be a lot of uncertainty and a lot of need that continues far through the summer?
Right. Yes, absolutely. So I actually had a meeting on Tuesday with Robin Riley to talk about some of their summer programming and what that would mean as it relates to, we know that our children are probably one of the earliest things that we need to really talk about as it relates to recovery and reopening, both elements of that. Because obviously if we don't have a safe place to have children go, we can't do much else, right? And so we were talking about, and I had a call with Caroline Sturgis this morning as well. She, I believe, is going to be leading up the effort around youth programming and how we're going to work on it for the summer. We know that, not only does Montgomery County operate camps, there are a number of private camps, feeding opportunities. Additionally, the municipalities all operate different programming over the summer. We want to have a more holistic strategy, recognizing that I think we all view it as very unlikely that MCPS is going to come back in session. And so the next real venture that we're going to have to talk about is what that means for the summer. And, obviously the summer schooling portion of that, MCPS is involved in the conversation, but absolutely one of the earliest things that we are talking about in this community recovery process, and probably actually the element of recovery that we've gotten into more of the substance sooner, is what our children are going to be dealing with this summer. So absolutely.
Well, thank you very much for that. I just have 2 other very quick ones. With MCPS food providers and with some of our partners, just ensuring, and I appreciate you already mentioning this about PPEs, but as we start to expand, they're going to need additional. And so I just want to put a plug in for additional support for them to make sure they have the required equipment. And then lastly, I just had a question about compliance issues. I've heard from a number of other jurisdictions that have had compliance issues. And so I'm curious, in Montgomery County, Have we had any? Have they been around certain particular areas of businesses that there's been consistency? Have there been particular areas geographically throughout the county where we've seen more rather than less? If you could just let us know about some of those things that you're seeing on the ground.
Sure. So we have a flag that we report on daily, which is coming in through the non-emergency line through police, the number of gathering or non-essential business violations that we see. We tend to get about 10 or so complaints a day, and we investigate each of those either through Health and Human Service licensure and regulatory, or through the police, depending on what the nature of the violation is. I don't know that there's been any geographic, and I could go back and take a look at that more closely to see if there's been any geographic distribution issues, but there are a lot of congregation that occurs, particularly in, and I know Maryland National Park and Planning Commission has been really forward in closing down a lot of the places that create the desire to gather, like our pavilions, playgrounds, things like that. And so we've addressed some of those through prevention. We've also addressed them through just communication. In most cases, people just don't realize they're actually violating. We have had a few circumstances. I know we talked about the car washes, I believe, last weekend that were shut down. That was something where Maryland State Police recognized that they did not notify us beforehand. We have asked them to do that in the future. Same with the city of Rockville, because that's where it was. They didn't receive early notification. So, I mean, I would say on the whole, however, our residents are doing an exceptionally good job of following the recommendations. We do recognize that there are violations. Most violations are occurring just by mistake and not by intentionality, but we are dealing with the few that are beyond that.
Dr. Gales, we want you to stay as long as you can, but we know that you have other pressing business. So if you have to leave, as much as we want you to stay, we understand if you have to leave.
Trust me, I've been multitasking while I'm here. So
hard to believe. None of us have ever done that, Dr. Gales. None of us, absolutely none.
Well,
Thank you very much.
I did want to add to what Earl mentioned. There is a measure, that I think it's a Google measure, that tracks the percentage of people who are staying at home. And we have outperformed our peer jurisdictions and actually have a higher percentage of folks staying at home than the national average. So, that number has dropped a little bit. It dropped by like 1% over the last 10 days, but we're still above average. So just wanted to emphasize that folks are doing a good job. So thank you.
Thank you very much. Vice President Hucker.
Thank you, Mr. President. Let me just take the opportunity to thank Dr. Stoddard and Dr. Gales for all your hard work. We really appreciate it. Mr. President, I had my question just answered. I had received a communication from the county attorney's office saying that the FAG grants wouldn't be covered by the feds. Then they got additional guidance last night from Treasury that says they would. So Dr. Stoddard's right again, and that's good news for all of us. So that's my question. It's been answered. Thank you.
Thank you. Councilmember Friedson.
Thank you for that. Thank you to Dr. Stoddard and Dr. Gales. Really appreciate all of your hard work around the clock, your responsiveness to each of us. It's not easy in the situation that you're in, and you really have stepped up, and I really do appreciate it. I just want to build off of Councilmember Hucker's comments. I am happy that the FAG grants, which we had been hoping all along would be reimbursable by federal funds, along with all the other special appropriations that we have been doing to try to meet this unprecedented crisis in real time and get ahead of the curve as best as we can. And I'm really proud of the collective work of this council and the county leadership of really doing tremendous work in that regard. But I did want to learn from you, Dr. Stoddard, now that we have some greater guidance on what the $183 million can be used for, are we going to get a plan or some type of demonstration of need? I mean, I think the council has really been leading this conversation in communication with you and Dr. Gales, but I'd love to find out if we're going to have something in writing or something to work off of that we can base some of these decisions off of. I think all of us want to move forward as best as we can with the needs that we have to get ahead of this crisis, but is there a plan for that and timing of when we should expect that?
Yeah, so we've been waiting for this last guidance that came out last night. The intention was, obviously, we were expecting it not to come out until tomorrow, so the fact that it came out a couple days early is great. Our goal would be to provide something to the county executive by the end of next week, and then I would expect it to county council soon thereafter. And so I would say within the next 10 days is what we're talking about. And that will cover our strategy that's long.
I think it'd be helpful to get it to the council when you get it to the county executive so that we could be reviewing it collaboratively in real time. I think that would
Sure.
be.
I don't think that is an issue. I'll take that back as a request, and I don't see that as being an issue.
I appreciate it. I think we've been working collaboratively throughout this crisis, and I think that would reflect the way that we've been addressing it from the beginning. And so I appreciate that and look forward to having that strategic conversation and continuing to demonstrate leadership that this county has in addressing this crisis. So thank you, Dr. Stoddard. Thank you, Mr. President.
Thank you. And Dr. Stoddard and Councilmember Reamer is going to speak next, but I did want to mention that I keep saying, as do many of my colleagues, that as much as we want to make a difference, and we do, and we are, the bottom line is we need to know how much money we need and how much money we need to spend in order to get there. Because if everything is piecemeal and we'll send $1 million, I'm not saying that $1 million is a little bit of money, but we spend $1 million. But if you need $10 million, that's not helping as much as we would like it to do. I mean, we're trying our best. All of us are trying our best to do what's right, but we need to know real numbers to make real differences. So,
agreed. Thank you.
Thank you, Councilmember Reamer.
Thank you so much. Just wanted to ask, Dr. Stoddard, thank you for everything you're doing. Can you send I appreciated your explanation of the cloth mask distribution. Can you just send it along in writing? I didn't catch every little piece of it, but I would love to.
Yes, I will get you that. I'll try and get you that today, if not certainly tomorrow. We've been working on a strategy to roll out exactly how we're going to utilize cloth masks. We knew we were getting 50,000 delivered this week. We have another 100,000 coming in next week, presumably, and 100,000 follow that along as well. We're also working on a number of other options. And so as we get more available resource, we're expanding that list of things that we will provide to, and I'll provide out some documentation on that strategy. I believe Councilmember Friedson had previously asked for that, so we'll make sure to provide it.
Super. Thank you. And then last comment, and this is for the future, but I think council members are very interested in how we can expand testing capacity, and many of us have asked about that today. So I think we really need to have a discussion as soon as possible about what additional resources could be used to expand our testing capacity. So, we'll be following up on that point. Thanks.
Thank you.
Thank you. Is it Dr. Stoddard? Are you the only other speaker today, or is there? I don't know that we have anybody else. I have nobody.
No,
else.
I think I'm the last today, but I can address some questions from the comms team if we need to an extent, as well as I think I've got the updates from the special populations team as well on a few things that they've been working on. If you're interested in hearing those as well.
Well, if you could give us a briefing, we'd appreciate that.
Sure. Let me pull up the full report while I'm sitting here. So as it relates to the comms team, they've been doing a lot of work on they're working with the Food Security Task Force as well, and so that's been one of the big areas of expansion. I do want to touch on the special populations report too. So they did meet with the African American Health Partnership yesterday, and they're providing updates on outreach activities. And there's a big effort around youth engagement that's ongoing right now. And so we've recognized, and I heard a report on the Food Security Task Force meeting as well from Joanne Barnes and HHS. They're finding when they go out and when we do some of these interventions where we see youth particularly that are they're not following the social distancing guidelines. When they go engage with them, they find and identify other service needs that are in the youth community that they're getting out of their houses and violating social distancing recommendations because they're trying to get away from a home environment that may not be particularly healthy for them. So that's both connected to the family violence prevention campaign that we're doing right now. In addition, they're working on an additional youth focused campaign, and they've got some geographic data. I don't have it in front of me about where they've seen the most number of those interventions being necessary, and they're trying to connect it through the outreach team Luis Cardona is operating in HHS to include additional resources and how we can get those resource connections formed, either through the food referral process and maybe through crisis center resources and other things. And so that's been a big focus this last week of the special populations group, to focus on particularly our youth populations, to make sure that they have access to things that we're seeing a need for more generally. Let me pull up the remaining report. So they did meet also with the Latino Health Initiative on the 20th. There was messaging needs that aimed at prenatal care during COVID-19 and how to make sure that we address those issues as well, and guidance to individuals who have tested positive on how to self-isolate at home. I think Dr. Gales may still be with us, but I know that there's been some effort and conversation around, and I think this came up on the Food Security Task Force as well, about where people may be asked to quarantine or isolate if they're ill, but don't have a very productive home environment in which to do that, and how we can make other opportunities available to them through hoteling or other options. I don't know if Dr. Gales wants to add to that for that question.
I don't know that he is still here.
Okay, he may have left us. Okay, so we can get additional information on that, because I know it's been something that he's been focused on. We have discussed the option of providing hotels to residents who may be struggling to find a safe quarantine or isolation environment. Again, the federal funds have pretty clearly stated that they will cover things like that, and so we do have hotels that are willing to do it. So it's just a matter of connecting those two resources together, and that's something that I know Dr. Gales has been working on this week. And you know, a lot of other things that we're working on. So we are going to stand up some additional mental health capacity, both for you know, a lot of information publicly, but also internally for the county's operations too. We recognize that, you know, given the long-term stress of this incident, we need to expand the team. It's essentially a safety team looking at the physical well-being of our county employees and responders. And we're talking responders in the broadest sense here, where we're not talking just about our first responders, but also those who may be working in our ABS stores, those who are working in inspections, making sure that they're operating in some pretty austere environments. We want to make sure that we have the appropriate mental and mental health supports for them, as well as physical health supports for them. So we work with Gary Stafford, who's the county safety officer under risk management. In addition, I've reached out to both OHRs, the Employee Assistance Program, as well as Dr. Crowell and the behavioral health team, to see if we can increase the mental health provider support, both for our county responders, but also to the broader community, because I think that's going to become, I mean, we recognize that as a need. We've been addressing it, but now we recognize the need is continuing to increase, so we need to dedicate more resources to it. So I'll stop there.
Any questions? I have nobody has texted me on this. Any questions otherwise? Well, thank you very much, Dr. Stoddard. And as you know, and I know that Dr. Gales, I guess, is there, and maybe if it's still going on, I'm going to go over to that one as well, Zoom over to that as well. But there's a Family Violence Prevention Program campaign news conference, as you certainly are aware of as well. And it's through the State's Attorney's Office, John McCarthy, and Debbie Feinstein from the State's Attorney's Office, as well as Chief Marcus Jones and Sheriff Darren Popkin, and many, many others who are certainly working on the domestic violence issue, which is obviously a great concern all the time, but especially right now. And then, of course, we also need to be dealing with the mental health issues. So we appreciate all that you're doing and all that everyone else is doing. And we will see each other, I guess, next week. So thank you. With that, we were going to go on a second recess. We will start again at 1:30, where we will have the legislative day, session day 15, and we will start at 1:30. See everyone then. Thank you very much for being with us.